Good morning everyone. I'm Dr. Sakshi and today we will be discussing about approach to a patient of peripheral neuropathy. So how do we approach? We have to take the proper history of the patient, what the patient symptoms have, like paresthesias, numbness or joint position problem, or patient has balancing problems. Then we have to do the examination of the patient, and then we have to see whether it is mononeuropathy multiplex, or polyneuropathy. Mononeuropathy means one nerve involvement. The cause can be compression, and the compression we have to just release the compression, and or we sometimes nerve repair is required. Mononeuropathy multiplex, that means there are multiple nerves are involved and non-contiguous sites. So we have to rule out whether it is axonal or whether it is demyelination. In axonal, the causes are mostly vasculitis. So we have to do the nerve biopsy, or some systemic conditions. Nerve biopsy is required for proper treatment of the patient. Then comes, if it is demyelination, then in that case we have to rule out HIV, Lyme's disease, paraproteinemia and leprosy. Then comes the polyneuropathy. So what is polyneuropathy? In that case also we have to see whether it is axons are involved or whether it is demyelination. Demyelination, if it is acute, then we have to rule out GBS and we have to give treatment in the form of IVIG or plasmapheresis. Like, and if the patient has demyelination, which is if the patient has the reduction in the velocity is uniform, or the patient has reduction in velocity non-uniform and with conduction blocks. If the reduction in velocity is uniform, we have to rule out first the paraproteinemia, which are the treatable causes, and if it is negative, then we have to rule the genetic causes, and genetic testing is required in that case. And if the patient has non-uniform involvement or there is conduction block, in that case, if it is acute, we have to rule out GBS. If it is chronic, we have to rule out CIDP, and treatment is given accordingly. Now, if the patient has axonal involvement, the causes are also the same. Like if the patient there is chronically present, then we have to rule out genetic cause. If the patient has subacute, in that case paraproteinemias or these and some systemic conditions, they are to be ruled out. Thank you.